Let me tell you something, ECG is not tough. It's actually very simple, if you know where to look. Start with lead 2. Lead 2 alone can tell you more than you think. If you see a P wave before every QRS complex, that is sinus rhythm. If the P wave is missing, think about atrial fibrillation. And if the rhythm looks irregular, the gaps between QRS complexes keep changing, and you cannot clearly separate the P wave from the T wave, that is atrial fibrillation. Now look at the T wave. If the T wave is tall, narrow, and pointed, think hyperkalemia. If the T wave is flat, or if you notice a U wave appearing after the T wave, something we normally do not see, think hyperkalemia. And if the PR interval is prolonged, and suddenly a QRS complex drops out, that is second-degree heart block. See how much lead 2 has already told you. Next, move to lead V1. This is your right-sided lead, and it is extremely important for arrhythmias and bundle branch blocks. If the QRS complex is wide in V1, there are only 3 possibilities: ventricular tachycardia, right bundle branch block, or hyperkalemia. If you are confused, remember this rule: if the QRS is wide and the rhythm is regular, treat it as ventricular tachycardia. Always check V1 and V2 for the Brugada pattern. Look for coved ST elevation with T wave inversion. When you move down to V2 and V3, watch carefully. Deep T wave inversion here suggests Welland syndrome. This means critical blockage of the left anterior descending artery. Do not miss this. Now, if you see ST depression in V1 and V2, never forget to think about posterior myocardial infarction. That's when the ECG asks you to look at V5 and V6. These leads tell the story of the left ventricle. ST elevation in V5 and V6 means lateral myocardial infarction. T wave inversion here suggests ischemia or left ventricular strain. And ST depression in these leads, along with tall R waves in V1, again points toward posterior myocardial infarction. Once you learn to connect ST elevation and ST depression across leads, 80% of ECG interpretation becomes easy. Make notes, practice, and read the ECG systematically. This is Nurse's Educator, simplifying ECG for nurses. There is some detailed material for CEG knowledge, find in the description. Thank you.